Hi there. 1.3 million people are harmed every year by medication errors. Most are preventable. I built MedAlly to catch them before they happen. Caregivers manage more medications than ever, but the warnings are buried in clinical language no one understands. The data is scattered across systems no one connects. MedAlly does what your pharmacist might miss and what your doctor doesn't have time to explain. Let's go to my patients page. Here, three demo will be provided for a user so that they can quickly run their checks against them and understand what it does actually. So, for the time being, let's start with the Margaret Chance demo. Meet Margaret, 72 years old, on a blood thinner, a pain reliever, a diuretic, a combination millions of older adults are taking right now. In one click, MedAlly checks three things no other consumer app does together: drug interactions, Beer's criteria for adults 65 and up, and the lab test her doctor should be tracking. Margaret's safety score is a D, high concern. Here is why. Coumadin and Advil together, one of the leading causes of internal bleeding in older adults. And every technical terms is tappable. In plain English, so caregivers actually understand what they are reading. Critically, what to watch for. Unusual bruising, dark stools, cuts that bleed too long, the signs Margaret's family needs to organize. And the beer criteria's flag. Advil is one of the American Geriatrics Society's list of medications inappropriate for adults over 65, with a safer alternative, acetaminophen, built from the AGS 2023 guidelines. This section will be provided only for adults from 65 and more than that. There is also a monitor section, which is not as severe as high risk, but the patients should be concerned about this. And then there are lab sections that the patients can ask the doctor. There are affected organs can be that can actually be affected from the side effect of the medicines. So there are relevant lab tests that MedAlly is suggesting. And there are also questions what the patient should ask to the doctor. And also a section where the questions to ask your pharmacist. And there is a ask AI sections. Ask the AI anything specific to Margaret's medication. Real answers grounded in her exact medication list, not generic web search results. This is a multi-turn chat with full patient context. The AI knows which interactions fired and which warnings are active. Okay, now let's go back to the my patients page. So Sarah, 29 years old, pregnant, and very different result. MedAlly fires pregnancy risk, flags for warfarin, Xanax, and ibuprofen, all category D or X. Her safety score an F. She needs to talk to the doctor. You can see the pregnancy specific sections. Also, there are high risk sections and also labs and questions to ask your pharmacist and the doctor's section. And now let's go to James. So, James 55 on common diabetes and blood pressure medications, no major interactions. Green banner, just lab monitoring. MedAlly doesn't cry wolf when nothing's wrong. This app also provides the dark modes of the user. MedAlly, three safety layers. Plain English, one score that tells you everything. Built on MeDo with FDA, Open FDA, NH, RX norm, and the AGS-BS criteria. Free for families everywhere. Because medication safety shouldn't require a pharmacist degree.